So it's Breast Cancer Awareness Month, and I know from having a friend who had reconstructive surgery that is really instrumental in giving women their confidence back. But what does that mean? What is breast reconstruction?
Wow, it's a touching subject just because I feel that my breast cancer patients are essentially like my heroes.
Of course
They're
they are.
so inspirational, so grateful. They're obviously going through a tremendous challenge. So people think, again, the physical nature of reconstructing the breast is a sense of wholeness. That's what I'm trying to help restore along their journey. But more than that, I think the mental and emotional wholeness of gaining that back is obviously very rewarding. Yeah.
Absolutely.
Welcome to Care Experts, a podcast dedicated to empowering you with knowledge for your health and self care. I'm Melissa, a broadcast journalist.
And I'm Selah, a former fitness coach and personal trainer.
Each week, we interview top wellness and medical specialists from across the country, addressing your questions, even those you might be afraid to ask.
From your fur baby's well-being to skincare secrets to honest talk about bigger health issues, get it straight from the expert.
Join us every Wednesday for insights that will guide you on your health journey.
From cosmetic to dental and vet to vision, this is Care Experts. Hi, Melissa.
I'm like taking a deep breath because our topic today, Selah, is close to my heart because I've had women in my family who have had to go through it.
Yeah.
And so, I mean, it just,
Same.
I'm so grateful, honestly, that breast reconstruction, which is what we're talking about today, is something that's an option that's available for women out there who need it, you know?
Agreed. Yeah, and it's something that can make something terrible that you're going through
Yeah.
maybe a little bit more helpful or
Yeah.
a relief a little bit more.
I feel like it's restorative.
Restorative.
It's transformative.
Absolutely.
And it's not just transforming your body from the outside. It's outside in, if you will, especially if you've gone through something really awful.
I
Like
know.
breast cancer or any reason requiring breast reconstruction, right?
Right, and it is incredible what, like you said,
Technology, what they
be
can
done.
do, what they can do these days.
Yes.
Yeah. And today we are going to talk to Dr. Edward Park, okay? He honed his skills and expertise in plastic and reconstructive surgery at Stanford University, progressing from an internship to chief resident.
Wow. And at Stanford, he also conducted groundbreaking research in wound healing and stem cell research, earning him a prestigious national research grant from the Plastic Surgery Educational Foundation.
And Dr. Park is also a board-certified plastic surgeon recognized by the American Board of Plastic Surgery and the American Society of Plastic Surgery, too.
Yes, he is the owner of Face and Body Cosmetic Surgery in Upland, California.
And you know what? For doctors who specialize in these kinds of surgeries and who have as much expertise as Dr. Park does, he'll be able to tell us why he chose that path
Yeah.
and what it means to him to be able to
Definitely.
help restore women who have had to go through such a traumatic experience.
Exactly.
You know?
I'm very interested to know and what it entails too.
Yeah, because I'm sure it's a lot.
I know.
It sounds, I mean, when you hear the word reconstruction, that sounds like a lot.
Definitely sounds like a lot. Yeah.
So let's bring in Dr. Edward Park so he can tell us all about it.
Yeah.
Dr. Park, come
Let's
join
do it.
us.
Hello, Dr. Park.
Dr. Park in the
Hi.
house, looking fly. Can we
Oh,
talk about that?
appreciate that.
I know.
With the
I
three-piece
appreciate
suit
that.
coming here stunting on them.
If
I
you
love
are
it.
listening and not watching,
I
you
know.
are really missing
You're
out.
missing out. You're
Because
missing
he looks
out.
amazing.
I appreciate that.
Dr.
Trying to bring
Park
some
is-
style back.
What? Back? Have you not always had style, Dr. Park? Is it new? Is it new to you?
I'm working on it.
So, Dr. Park, you are a board-certified plastic surgeon, and you're the owner of Face and Body Cosmetic Surgery, which serves Upland, California, and the Inland Empire. So we know that you're a surgeon. What led you down that path?
Oh, wow. That's a long road.
Tell us.
I can start from childhood.
Sure.
Yeah.
We want to hear.
The brief journey is, I loved medicine growing up. I loved science, math. I loved math, numbers, and all that.
And you were good at it.
I was
clearly.
pretty good at it. I'm not
Okay.
gonna lie.
All right.
I like to multiply and stuff, but I really loved science and got into med school. And I think thereabouts when in med school, kind of learn different specialties. You hear about all the different ones, but we talk about the thinkers who are the real docs and the surgeons who are the doers. I liked Legos and model airplanes and things like that. So ultimately, plastic surgery was kind of the most creative field. A lot of
Yes.
people don't know that we operate all over the body. So everything from head to toe, reconstruction, craniofacial, hand. So,
And it could be very, like you said, very creative, very artistic in the way
right.
that you choose to
Yeah.
make a stitch or make a incision.
Absolutely.
That's so cool.
I think if you interview or ask a lot of plastic surgeons, a lot of us have a creative background whereby for me, it was growing up with the violin. So I played the violin all
Oh,
my life and kind of thank my mom for that kind of creative slant towards it.
Shout
yeah,
out to mom.
absolutely. You're literally sculpting someone's body sometimes, right? Like it's like
Absolutely.
you're a sculptor.
Yeah, absolutely. I would say that's a key kind of verb that we use a lot of, whether it's the nose or a breast after reconstruction. We are doing a lot of
Mm.
sculpting.
So it's Breast Cancer Awareness Month, and we know from, I know from having a friend who had reconstructive surgery that that is really instrumental in giving women their confidence back. But what does that mean? What is breast reconstruction?
Wow, it's a touching subject just because I feel that my breast cancer patients are essentially like my heroes.
Of course
They're
they
so
are.
inspirational, so grateful. They're obviously going through a tremendous challenge. So people think, again, the physical nature of reconstructing the breast is a sense of wholeness. That's what I'm trying to help restore along their journey. But more than that, I think the mental and emotional wholeness of gaining that back is obviously very rewarding. Yeah.
Absolutely. What does it entail usually? Can you walk us from the beginning?
So yeah, the once a patient is diagnosed with breast cancer, I usually will work in conjunction with two other doctors. An oncologist is kind of gives a chemotherapy treatment. There's a general surgeon that I'll work with in conjunction, usually on the same day of surgery, where when they perform the mastectomy, I'll do the reconstruction at the same
At the
time.
same
Yeah,
time. I never realized
yeah.
that.
Yeah. Are there
Wow.
different types of breast reconstruction surgeries?
Correct. So the more popular type of breast reconstruction is using implants, as we do in cosmetics. So the mastectomy is done. I'll place a tissue expander to expand the breast tissue, skin, and muscle. And then at a second stage, we'll do a swap about 6 months later once the patient has expanded the skin to the size that she wants. And then we'll put a silicone implant in. So that's one type. The other type is what we call autologous tissue reconstruction. So we can take tissue from anywhere in the body, whether it's the gluteus, the tummy, and swing it up to recreate the breast that way.
What do you
Wow.
think is like better? What do you like more?
I think the beauty is I try to instill the choice upon the patient. And so there are pros and cons to both, but more popular is the implant-based reconstruction.
Okay.
The tissue one obviously has a lot more recovery. And
Oh,
so we're taking from the tummy, that's going to hurt a little bit more. So a little bit longer recovery. But if someone does not want any foreign body, they'll go with the tissue
oh, I
reconstruction.
see. Okay.
Yeah.
What kind of a patient is a good candidate for breast reconstruction?
Well, unfortunately, cancer is unselective,
Yeah.
biased to anyone. So I see patients of all ages and all conditions. But the good news is breast cancer in and of itself is generally has a very good prognosis.
Right.
Yeah,
Thank
so
Now,
God.
yeah, thank
yeah, a
goodness.
lot of
Yeah.
patients do very well and live long, long lives and are great survivors. So as long as they're healthy, they'll do well.
What kind of questions should someone ask if they are considering breast reconstruction to a doctor?
There's usually when they come to me on the first visit, they're pretty overwhelmed by the diagnosis and such.
Hmm.
So, my job more than anything is to really listen to them in any consultation. So I try to see where they're at. And then that first consultation, I'm just giving them a general timeline of what I do because it is a long journey. This is very different from aesthetic reconstruction, where it's kind of a one and done, so to speak. We're doing multiple visits in this reconstructive process, and the whole journey can sometimes take up to a year.
Oh, wow.
So,
Incredible.
yeah.
Do sometimes people do one, or is it always both at the same time?
That's a very good question. Again, leaving it up to the patient and the cancer physicians, and if someone is diagnosed with a small cancer, sometimes they'll only reconstruct the one side.
Really?
Yeah.
I was not aware of that.
Yeah. And then at the second stage, to match the one side, we'll do a reconstructive, like a lift or whatnot,
Okay.
for symmetry for the breast. Yeah, to remain symmetric.
I see.
So your treatment plan is determined on a case-by-case basis?
Absolutely. Yeah.
Okay.
Very
Very
individualized
individualized. Okay.
based on the stage and type of the cancer, and also based on, like you said, like what type of reconstruction they're looking for. There are some women that may opt not to do a reconstruction right away, just because of an emotional component, and maybe do a delayed reconstruction years later.
I had a friend of mine who was born with uneven breasts.
Mm-hmm.
Is that common, or how do you fix that?
Yeah. Well, it's funny because when I consult with a patient, I always draw a line down the middle and say, look, God made us all unequal left and right.
Right.
We're
That's
all
true.
asymmetric.
Asymmetrical, yeah.
And oftentimes, to your point, when I'm doing measurements on the chest wall, I'll find, differences between right and left. But the largest asymmetry I've seen was in a young girl who had an A cup and a D cup.
That's what she
Wow.
had. That's what
Yeah.
my friend had.
So that then becomes a pretty intricate reconstructive process where I'll have to do a lift on one side and an implant on another to try to achieve symmetry.
How long does a process like that take? Just the surgery itself?
I'm pretty diligent at it, so it kind of depends. But something like that, if I'm doing a lift and an implant, is about 90 minutes or so.
Oh, wow.
If we're talking about straight implants, a lot of surgeons can do those in about 30 minutes to an hour.
No
Wow.
way.
Yeah.
I had no idea it was so fast.
I'd love to talk about the timeline again, though. So you talked about it taking up to a year from
Right.
beginning to end with breast reconstruction. Can you kind of map out what that timeline looks like from the first appointment, the consultation, all the way through the end to where the patient has fully
Yeah,
reconstructed breasts?
absolutely. So on the first visit, I'm generally outlining what's going to be done on the first surgery. The first surgery is going to be the largest. Once again, I'll be combining with a general surgeon. He'll do the mastectomy, and then I'll put in an implant tissue expander at the same time. That surgery can last anywhere from 2 to 4 hours,
Okay.
a little bit longer recovery. During those next 3 months, I'll be doing tissue expansion, where in clinic, we'll put in a needle into a port into the implant and slowly expand the tissue expander. So that'll happen for about 2 or 3 months until they're to a size that they like.
Okay.
And then the second surgery is usually done at about 3 to 6 months. Put in the silicone implant and take out the expander. Pretty quick for that one. Then we talk about nipple reconstruction and areolar
Oh.
tattooing. So that's the final stage that can happen about 3 to 6 months later.
Wow.
You talked about also, I feel like I'm dominating this conversation because I'm so interested. I unfortunately lost one of my close friends to breast cancer a couple of years ago. And I know she went through some of this process. It had metastasized and gone to different parts of her body. But I'm so interested in this because I want to make sure women out there know their options and that they
Right.
don't feel guilty about doing this or moms taking away time from their loved ones or their kids, because if you need this for you, you've got to have that
Absolutely.
self-care. What does that do for you as a surgeon when you see a woman come in overwhelmed with the diagnosis the first time she sees you, to when she is hopefully cancer free and you have helped restore her? What is that like for you?
I mean, first of all, when they come through my door in the first consultation, I'm thankful, first of all, that I'm a part of their journey.
Yeah.
Because going back to the initial diagnosis, women have to understand that they do have a choice in restoring and reconstructing their breast. And a lot of women, when they're first diagnosed, are overcome with fear that they want to do the quick surgery like a lumpectomy or radiation and not even think about reconstruction. So unfortunately, I don't even get to see a lot of patients until they are referred to me.
Okay.
And so the very first comment I would make is it's very important, I feel, that women know that they do have the choice. And to even request to see a reconstructive surgeon just to gain knowledge, they don't necessarily have to proceed.
Well, and like you said, it's kind of good if you can do it at the same time.
Right.
And I mean, there seems to be a lot of benefit to that.
Absolutely.
Right? Yeah.
Yeah. Yeah. More,
That's
yeah.
amazing.
But what does it do for you? Are you the kind of person, I see your bracelets. I see that spirituality means a lot to you.
Thank you.
And you're
Yes,
talking about being a
absolutely.
part of someone's journey,
Yeah.
you know, and restoring them physically,
The
but then
journey of
also
healing.
emotionally and the
Yeah.
healing process. It's got to feel pretty great.
Absolutely. I look at all areas. Once again, I sit in gratitude and I really try to listen to the patient. It definitely is, it's a gift to be able to, and a blessing to be a part of their journey. And like you mentioned, this isn't only a physical journey. We're talking about emotional and mental support that not only I'm providing for the patient, but my staff and other patients that I introduce them to that have gone through this journey. That, as well as a spiritual journey that I'm sure they're going through, it's just a blessing to be a part of it. And I gain a lot of just gratitude from them, just overcoming such a difficult challenge in life. Yeah,
Absolutely.
yeah.
So, as far as the surgery goes, it seems like it's a lot. Like you said, there's 3 different parts where they have to actually go in. So, how is
At
the
least.
recovery? Yeah, at least. How is the recovery? Is it very painful? Can they not move for a while? What is that like?
That's a good question. The very first surgery is going to be the most critical, and it does involve a little bit more recovery. If I'm doing a mastectomy combined with an implant reconstruction, usually after a week or so, they're back to driving and doing light
Really?
activity.
Just a week?
Yeah.
Okay.
So it's not as terrible or as involved as saying like back surgery or something that's very
Right.
deep. So it's not too much different even from doing aesthetic implant reconstruction. So in
Okay.
terms of the recovery, so they can expect to get back to their lifestyle, their kids, their work pretty
That's
quickly.
amazing. But
Yeah.
not lifting heavy, obviously, stuff like
Heavy
that.
lifting generally about
No
4 to
push-ups.
6 weeks. Yeah, no
Yeah.
push-ups in the first
Yeah.
couple of weeks. Yeah.
Gotcha. Okay. And what about the other 2? Because you mentioned there's the
Right.
right. Okay.
So at a second stage where I'm just doing a change out of the implant, they can probably start driving in about 2 or 3 days.
Oh,
A
wow.
lot quicker.
No idea.
I
Yeah,
know, I
Okay.
very
know, I
quick.
know.
Recovery has gone a long way. We used to tell people to not move, but now it's like, hey, we want to get you moving.
Get
Come
the
Sure.
blood
on.
flowing,
Yeah.
stuff
Yeah,
like that.
exactly.
Okay.
Get the
That
blood
makes
flowing,
sense.
get your range of motion back. Those are good things.
That's so
What do you
cool.
say to your patients to help them set realistic expectations for their recovery?
That's a good question.
Wow. As far as like yeah, a lot of them ask, for example, I want to go back to the gym. And
Ah.
I want to
that's
do
a
those
very
things.
I know.
common.
Yeah.
Yeah, they want to
Yeah.
get back to the. So I just kind of outline the recovery process very clearly and succinctly. Say, hey, you can drive at about a week. You can do light walking at 3 weeks, and hit the gym at 4 to 6 weeks.
That's not bad.
Yeah,
4 to 6
that's
weeks.
about a good average.
That's pretty good.
Yeah,
Okay.
absolutely.
That's really interesting.
Is there something that you say to patients who are coming to you for the first time and they're just kind of considering breast reconstruction, but they haven't said, yes, I want to do this? What do you say to them?
Yeah, that is a choice that they should definitely go home and think about. We're talking about breast reconstruction is a very, very deep decision. So
Sure.
oftentimes there is no rush, other than if the general surgeon is trying to do the mastectomy right away, then they're kind of prodded to make a decision. But I certainly don't make them make the decision right away.
Right.
I'm simply there more for kind of a support outlet and to give them information for that very first meeting.
Guide them.
Yeah.
Okay, I've heard about mastectomy bras and swimwear. Is this a thing? Like that?
It's funny you mentioned that. As an off topic, my wife is going to model for an organization that we're involved in called Mission Plasticos.
Okay.
And we do nonprofit breast cancer reconstruction for those who can't afford it.
That's amazing.
And in about a month, she's actually walking down
A runway?
Runway?
modeling runway
Okay.
to model exactly that. There is a lady who designs post-mastectomy bras. So,
Wow.
yeah.
Man, that's such an interesting and
Yeah.
helpful product.
Yeah.
I mean, I'm sure so many women
Absolutely.
will benefit from
So
this.
to your point, when they do a mastectomy and they don't have the implant yet, they do make inserts and such for
Oh,
these
that's
cancer
so
patients.
cool.
Yeah.
What a great idea.
Yeah.
That's amazing.
What tips would you give to someone who is adjusting to their newly reconstructed breasts for their confidence, for their new body, this new look, this new feel?
Yeah. The very first appointment, the most important thing I really mentioned to them is having a support system.
Hmm.
So I kind of asked them what kind of support system they have. We have a string of a lot of breast cancer patients of my own that are willing to talk to newly diagnosed patients.
Oh,
So
that's
that's
cool.
one of the first outlets I'll provide is say, hey, if you want to go talk about this with one of my patients that have gone through this, here are some numbers because I think that the mental and emotional support is far more important than, of course, the physical journey,
Yes.
which will get done. So,
Definitely. That's
yeah.
so great that you provide that resource for them.
Yeah.
That's
very
really
important.
nice. What is the difference, by the way, or what do you tell the patients the difference between a reconstructed breast and a natural? What should they be aware of as far as comparing or feeling, you know?
Yeah, for a reconstructive breast, what we always say is that it's never going to look perfect like it used to be.
Okay.
But once again, what I'm trying to do is restore them, number one, restore them to wholeness
Mhm.
and to provide symmetry. So I do want to make the right and left look as symmetric as possible.
That's
So
awesome.
those are kind of the main points.
Okay.
What do you tell your patients to consider when they're choosing the best surgeon for them when it comes to breast reconstruction?
Wow. Um,
Pick me, but
Yeah.
other than pick me,
Yeah.
but like, what should they be?
Like, what
what
are
should
the
they be
three-
looking
it's
for?
it's funny because I actually say don't pick me sometimes.
Really?
Why not?
And the reason for that is a lot of us private practice people, surgeons, do the implant reconstructions. So, for example, let's say you said, I want to do the tissue reconstruction. I don't perform a lot of those, and those are
Okay.
best served in universities
Oh.
or big private groups that do a lot of these because they need some good, very important, detailed post-operative care because it's a very intricate process.
Yeah.
So I want to make sure that they're in the best hands. And so if they do say, hey, I want to do the gluteal tissue reconstruction, I'm going to refer them to a very good surgeon. So oftentimes I'll have to say no in their best interests.
Oh.
But are there special qualifications like board certifications that someone should be looking for, a certain facility that you're operating out of?
Absolutely. Yeah. Make sure your surgeon is board certified in plastic and reconstructive surgery.
Okay.
We can talk about this a little bit later, but the Board of Cosmetic Surgery is not really confirmed by the American Board of Medical Subspecialties.
Really?
That's very important to
Oh.
understand. And so, especially with reconstruction, you want to make sure you to go to a board certified plastic and reconstructive surgeon.
Wow, that it's specifically that.
Yeah,
That
specifically
makes sense.
that.
What about experience level? Or should they be looking for a certain level of experience or number of years in practice?
I think so. I think in any consultation, you want to go to someone that does a lot of what you're looking for.
Right.
Yeah.
The new guy, I mean, you can try, or the new gal, you can try it, but
Not with your
um,
body.
yeah.
know,
So
yeah.
I agree with you. I think
Yeah.
experience does go a long way. I've been doing it for 20 years, but I did start off, as the first year, second year person.
Of course.
And so that's where the training is really important. So, sure, I was nervous a little bit in my first year, but quickly became adept to it. And that's because I did 6 years of training in plastic and
Right.
reconstructive surgery. So,
Yeah, it was old hat by then.
yeah, yeah.
And what about aftercare? Because, I mean, you talk about having the support system in place, but you're not going to be able to lift heavy things for a little while. You're not
Right.
going to be able to drive yourself from the appointment and all of that. Are there special facilities that are associated with your practice that Is that something
People
someone
go to a
be
different facility, right?
Right,
Or they go
right.
home with a nurse. Is
Right.
that
So
kind of thing?
usually so in my facility, I have a surgical center that's an outpatient. So
okay?
I'll do
Oh,
all my cosmetic surgery procedures there and they get to go home.
Okay.
However, if I am doing breast cancer reconstruction, usually that'll be done at a hospital. So
Oh,
I have privileges at San Antonio Hospital, and
okay.
I'll usually do it there. And then they'll stay overnight at the hospital, and the nurses will take care of them for one or
Oh,
two
that's
nights.
great. But if you go home, you do get a nurse or something like that.
For our type of surgery, you don't necessarily need one
no,
as
but
long as you have a good family member
Good
or
yeah,
husband
someone.
there.
The
somebody,
husband's got to
somebody.
step up. He's
Somebody's
got
got
to
to step
step
up.
up a
Yeah.
little. Real important to have that support. Yeah.
In the age of social media, we're all so obsessed with looking perfect.
Yeah.
And I love that you talked about setting expectations because obviously a
Right.
natural breast will look different from a reconstructed breast. But should patients be bringing in like before and after photos that they've seen or comparing to something they've seen on Instagram or other places on social media? Do you like that?
It's funny you mentioned that. I have kind of a mixed feelings on social media and photos because
Okay.
I think social media in general has brought everyone's expectations into an unreality.
Way
Like
too
this is
high.
not
Not
Yeah.
realistic.
exactly.
Mm-hmm.
So, but to your point, if I am, for example, doing a rhinoplasty or even a straight breast augmentation, I do like photos because I'm a very visual surgeon. I tell them, look, I want to see your dream vision
Okay.
body, and it's very artistic. If you show me your Picasso, I can paint that.
Yeah.
So I do like
That's so
pictures,
cool.
but I also know that if someone's showing me a rhinoplasty and showing me every single angle, they're getting a little bit
It's too
obsessive to
much.
that, then I may
Yeah.
not be the right surgeon for
Are
them.
you gonna tell them that? Are you gonna be like, or are you gonna say, look, sure, but I'm not sure that would look great on you. I can do that, but that's not for your face
Yeah.
or your body.
Yeah, absolutely. And I think that's the most important point is for me to connect with the patient on the expectations. And
Mm-hmm.
if I feel like, hey, I can't meet that expectation, I will gladly refer them to the rhinoplasty
Right.
expert or someone like, NASIF or someone. Yeah.
Now, all of these breast reconstruction services and surgeries, are they covered by insurance or how do people finance these?
Yes, to
Okay.
your question, yes. And they will also cover common question, the normal size breast. So, for
Oh,
example, let's say you had one cancer on one side and you needed to get symmetry, the insurance should and will cover the normal side to be lifted or
wow.
implant to match for symmetry.
Oh, that's
What if
great.
someone doesn't have insurance though? Does your office offer financing options?
And that's why I like to be a part of a nonprofit. So one that I'm involved in is called Mission Plasticos.
Okay.
And so once again, they can't afford it. We provide that service for them.
That's so
So that's
cool.
something I kind of want to also in the excuse me, in the future develop a nonprofit for these people that can't afford cancer
So
reconstruction.
great.
Yeah.
That's so
Why is
kind.
that so important to you?
It's funny you mentioned after doing it for 20 years, and I feel again, once again, so blessed to be able to do this. I You enter a phase where I want to give back, and I
Mm-hmm.
do want to do some charity and be able to do nonprofit work for those who can't afford it. I think
That's really amazing.
it's important to give back to those who aren't able to go through these. So that's kind of a very near and dear project that I'm kind of creating.
That's so
Yeah.
cool.
It's time for our one of our favorite segments, though. Now, Dr.
Yes.
Park, it's called Ask the Expert. So these
Oh,
are questions that have come in
okay.
from
From our
our audience.
audience.
Oh,
So
wow.
we're gonna ask you. So you just got to be honest and tell us exactly what you
Okay.
think.
Yes.
I'll be as honest
All
as I
right.
can.
Okay.
Here's one. Can you breastfeed after a mastectomy?
So for a mastectomy, the short answer is no,
Okay.
Oh.
because remember the mastectomy is removing all breast tissue,
Oh,
including milk ducts,
milk
etc.
ducts. Okay.
As well as sometimes they'll remove the nipple, in which case
Oh,
breastfeeding
right.
won't be able to
Oh,
be.
I wasn't aware
Okay.
of
Yeah,
that.
so
Okay.
sadly, no.
This is why we ask the questions. Okay. Will patients lose sensation in their nipples after undergoing a mastectomy? I think I already know the answer because of what you just said.
You're gonna
Mm-hmm.
say?
Yes, they
Yes,
will
they
lose
will lose
sensation.
sensation.
Correct, correct.
Oh.
And same idea, when they're removing the breast tissue, they're removing all the nerves as well.
Mm.
And sometimes the nipple as well. in which case later I'll do a nipple reconstruction.
Okay.
Yeah,
And the
but no
areola
sensation.
tattoo, I feel like you
And the
mentioned that.
areola
You touched
tattoo.
on that,
Okay,
yeah.
okay.
Exactly.
Okay, here's another one. How close can you achieve a more natural look after surgery? Can it be as close to your pre-surgery look?
It's going to be as close as we can.
Okay.
Nothing, when we're doing reconstruction, our philosophy is we want to get it as close to normal as possible. Sometimes we can get great results, and sometimes, depending on the tissue and if there's other factors, then we might not get as close to normal. So there's some variation in that.
It's never going to be your complete natural look that
Agreed.
you had before.
Agreed.
That makes sense.
Yeah.
Here's a question. What will the scars look like after reconstruction is completed?
You know, it's funny. As we work in conjunction with the general surgeons, they're the ones who actually make that initial incision. And oftentimes, if you look at a mastectomy breast, it's kind of a horizontal across. So I try to plan with the general surgeon to make not as long of a scar as possible.
Yeah.
So if I'm involved, that's kind of important to try to minimize scarring. But usually it's about a horizontal scar for them to remove the breast
Okay.
tissue. Yeah.
Over time, does the scar get better, or are there options for treating the scar so it can get better?
Yeah, there's always going to be a scar
Okay.
once there's a scar, but there are ways to kind of make him a little bit faint with scar creams and such. We also try to create the areola and the nipple over the scar to kind of
Oh.
disguise the center part.
What is that areola tattoo? Can you go into
Oh, I
that
know.
one?
I'm like thinking the areola tattoo.
that, yeah.
So literally, it's a tattooist, as if you're going to. However, they are specialists in creating the three-dimensionality of the areola.
Wow.
It's pretty awesome.
very artistic.
Very
again.
artistic.
Another creative.
Goodness.
avenue.
But it's, I mean, literally giving women back their lives, you know, in so many. Their
It's
womanhood.
restorative is what
Yeah.
it feels like, right?
Exactly.
Visually as well. I mean, when you see the three-dimensionality of their tattooing, it's pretty impressive. It looks very real back to how they
Wow.
used to be. Yeah.
That's amazing.
Yeah. It's impressive.
Thank you so much, Dr. Park, for
Yeah.
being there for us today and for all of these
Absolutely.
women that you have helped. It's
We can tell it's
amazing.
near and dear to your heart. Like you're restoring wholeness to women, and we appreciate you coming to chat with us today.
Thank you. I appreciate that.
Was there anything we didn't ask you want to share with us?
Oh wow! I mean, I could go on and on and on.
Oh,
we're here all
but,
day.
no, it's again. Once again, I would say one final point is if you are diagnosed, unfortunately, with breast cancer, there is absolutely hope, and to just have faith that you're going to overcome it and also get a wonderful result with a great plastic surgeon.
That is very positive and
Yeah.
so encouraging to so many women.
Thank you so much, Dr.
Yeah,
Park.
thank you.
Thank you.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.
Hey, stick around if you want to hear more about health and wellness in these episodes of Care Experts. Don't forget to like and subscribe.